Hello, and welcome to our lecture on Chapter 10. We'll be discussing strategic thinking and achieving competitive advantage in health services organizations. Now, the purpose of today's discussion is really to talk through strategy, the ideas behind strategic thinking. We've talked about systems thinking already, but what does strategic thinking look like as healthcare leaders working to improve their decision making and lead health services organizations? We'll talk about the principles of strategy and strategic management, of course, but we're going to dive a little bit into their applications and what it looks like to have discussions with other organizations that you're considering merging with internal stakeholders regarding future direction, right? Some of those are challenging. Now, to get us started, we're going to talk a little bit about creating, implementing, and directing our organization. Now, when we do that, we walk through several predictable steps. We start out with formulating goals, scanning the environment around us, which sometimes leads to changing those goals, formulating very specific strategies, tactics, ways of achieving those goals, evaluating whether or not they're appropriate, right? Comparing, deciding where to put our money, implementing those, and then controlling or making sure that we get the results we're looking for and evaluating whether or not it worked. Now, we have to think about the environment quite often. The policy landscape is constantly changing, and in health services administration, there are a lot of variables, as we talked about, especially in our last chapter on dynamic complexity and learning and innovation, and then the following chapter, so the last two chapters, dynamic complexity, learning and innovation, and quality improvement. Now, strategic management helps us assess the threats and opportunities in our environment, make good choices on how to move forward and execute effective strategies. So I have just a couple slides here that review changes that are happening in our environment. And one of them is the aging population. Now, this is a graphic that shows a predicted percent of the population 60 plus and 65 plus and 85 plus over the next 30 years, 25 years. You can see the growth in aging individuals is pretty significant, especially when you consider that we're going from having very few individuals over 85 to up to 5% of the population being that age and requiring significant care and support in that as they are older individuals. Now, we also have to think about the demographics in the community we're serving. So this is an example of demographics by race, ethnicity. Sometimes we used to use the word minority, right? We talk about BIPOC communities, communities of color, different areas, different demographics, different norms, different cultures. But it's important to realize that not only do you need to tailor your services to meet the need of the population you're serving, but you also have to keep in mind that it's important that we have linguistically competent, culturally competent professionals, and that we're aware of those changes and how they affect our strategy, our marketing, our outreach. So we're going to start out with a broad definition of strategy, and strategy really is this broad formula approach to figuring out how we as a business, as a healthcare organization, want to collaborate, compete, set goals, establish policies. How are we going to run our organization? Who are we? What's our image, right? Who are we going to work with and compete against out in the community? And so a lot of that involves making difficult decisions about allocating resources, about allocating funding, and challenging existing assumptions. Now, part of that also involves an annual or every few years strategic planning process where we actually go through, and we do this normally every few years, we reevaluate and look at our vision and mission as an organization. We'll come back to that later with some specific definitions around that. But really, it is about how that vision and mission, who we are and what we want to accomplish, translates into actual work, assigning of responsibilities, expected outcomes, follow through, and how we work to increase the competency of our staff, right? Identify people who are responsible, who will be held accountable, and work with them to do good things. So this is an example of a strategic planning process. You'll notice at the beginning, it's so funny because it's a term I often use sarcastically, planning to plan, but they actually have it on the graphic, planning to plan. So we're going to start out by planning to plan. We're going to start out by thinking about the health services organization we're in and really putting tools and templates and scaffolding, if you will. Sometimes we call them artifacts, but we're going to have the right approach, the right time set aside to do this right. We have to understand what the organization values to then formulate their mission and vision or update, right? And then use that to set specific strategic objectives, goals for the year or in general, right? Maybe for a longer period of time. Look at our gaps, figure out what that means from a strategic planning perspective, meaning what are we going to do about it, and put those plans in place. So it's a very interesting, fun process. And depending on the role you work in a health services administration, you might work in different areas. This is another view of that because not every organization uses the same terminology. So this is a view of a strategic planning process in another organization. So we're gathering inputs, we're doing a SWOT analysis, looking at strengths, weaknesses, opportunities, and threats. We're reviewing those inputs. We're putting together a strategic matrix of all the things we could do. We're selecting those, right? We're selecting alternatives. We're defining those strategies, and then we're approving them, we're implementing them. We're holding ourselves accountable and evaluating if we were successful. Now, when we think about values, mission, and vision, it's really important that we think about those very concretely because they become very abstract, open concepts. So I want to make sure you have a good handle on the basic definitions. So a mission statement is a written description of an organization's purpose for existing. It is who we are, which is uniquely separate from a vision statement, which articulates the future manifestation of the organization, what they want to be, right? So if you say we want to be the best in class healthcare organization chosen locally, but we're not yet, that's your vision, not your mission. Your mission is to provide excellent high quality care maybe, and that's what you do every day. That's who you are. We also have to keep in mind we need values. And sometimes these are short sentences, but quite often it's a list of things. Integrity, respect, quality, efficiency, things that are important to our organization and things that our members and our leadership have decided. And that's what we do. We meet with stakeholders and we say, who are we? What's important to us? And we make a list of words that symbolize who we are. And we identify common values among stakeholders to kind of synthesize that into a short list of words. And these should be memorable. They should be important and visible to employees. Mission. Now, again, the mission is who you are. It's your foundation for strategic direction, but it should also be something that feels like you can tell if it's done or not. Your textbook says measurable and definable. It normally doesn't have percentages or rates or specific objective type language, but you should be able to tell whether or not that's really who you are when you read a mission statement. And it should feel like it's calling the employees to action. They're believing that, yes, this is who we are. This is what we're doing. So this is an example from Summit Healthcare. And it says mission, they're trusted to deliver exceptional, compassionate care close to home. Okay. But their vision isn't just who they are, it's who they want to be. They want to be the regional health system of choice. And they're going to do so by embodying their values of quality and safety, teamwork, respect, accountability, and communication. Now with vision statements, right? Again, these are future oriented. These should also resonate with your team. It should get people proud and excited. They should be thinking about striving towards the future. And it should challenge and stretch your current understanding of your organization's identity and help you define who you want to be and specific outcomes you want to obtain. So this is Lutheran Health. And Lutheran Health's mission vision approach is a little bit different than the last slide. They've got a longer mission statement, which sometimes happens. And it says Lutheran Healthcare exists to serve its neighbors. We are dedicated to caring for the whole person throughout our whole communities. As a stabilizing foundation for these communities, Lutheran is committed to meeting our neighbors' changing physical, emotional, spiritual, intellectual, and social needs. Now, to me, this still feels almost a little vision-y. It feels a little future-oriented, but it is who they are. But it's their current and ongoing commitment. Whereas vision is they're striving to become the provider of choice. We want you to choose us. So we want to be the best. And of course, you can see they have their core values listed here of compassion, dignity, respect, inclusivity, right? All fitting that. Okay, I hope those examples were helpful so you can see the differentiation. So once we know our mission, vision, values, we can think about what we're doing out in the community. Are we competing with certain folks? Are we collaborating? And how important is it to compete in the health services organizations, especially depending on if you're a skilled nursing facility or a hospital or a health plan? Uh, and so we talk about this idea of competitive advantage or strategic advantage, where you're the winner, you're the best, you're making it happen, versus collaboration. And so sometimes we need to have strategic advantage in certain industries in order to survive and do well. But quite often, not-for-profit hospitals and health systems whose mission is to provide service to vulnerable populations don't prioritize this strategic advantage. So the setting that you work in really dictates how much you use some of this information that we're talking about and how you leverage it and understand and process it. So we've got lots of strategies that we implement as health services administrators, and they evolve and change over time as the environment changes, as our patient base changes, as the policy environment changes and what's legal and how we're paid. All of these pieces as there's new technology, new changing customer demand. Now, if we just talk about hospitals and we think about the hospital business model, there's really what we call an erosion in customer value, where we're trying to provide value to the customer, but it's very transactional, right? You come in, you leave the hospital. How do we create relationships? How do we build on the perspective of whether or not we're providing value, right? Shape that viewpoint. Now, we also have to realize that we are working with the inputs of professional healthcare personnel, supplies, right? Space, all that are very expensive and costly and challenging to manage. And we're transitioning that through different processes to generate revenue. And so that's our business model. But we have to try to do our best to illustrate that we're providing customer value through that effort. And so this is components of a business model. When you think about a business model, you're thinking about what value am I providing the customer value. What are the inputs that I'm getting from the community to do so? I've got nursing staff, I've got physicians, I've got pharmacy and supplies, I've got space, I've got laundry. What am I using to provide care? How am I using processes and efficiently using those resources in a way that maximizes profitability for my organization in many cases, but also maximizes customer value? I want to do a good job. I want to get paid well for it. I want to help the community. Now, the organizational environment is dictated by a lot of things, the mood, if you will, customers, competition, right? How the leadership feels about their place in the community, right? Are they engaging in doing community-based events? That changes the environment. Or is there an adversarial relationship with certain community groups? That changes the environment. And so we want to work collaboratively and cooperatively, but we also have to be real about competition and about the needs of our customers. And so to do so, we assess the structure of the market and we look at whether or not it's competitive or not. And we've got a couple different definitions here around competition, but many parts of healthcare are oligopolies, where we have several health systems in a small area, right? All kind of competing, a few large companies. Sometimes we have monopolies, right? I know that I live in East Tennessee, and there's a healthcare monopoly here with Ballad Health. They own a lot of the market share in East Tennessee and the neighboring sections of Virginia and just this whole corner of the universe, right? And so that's a monopoly. Now, we also want to think about how we understand the market itself and how that dictates the monopoly versus oligopoly question. So, if you are providing a lot of services, you may have different competitors. You may have a different competitor for the cancer services you're providing versus some of the surgical services you're providing. And so in order to understand this, sometimes we think about it from an organizational viewpoint. Sometimes we think about it from a service line viewpoint. So keep that in mind. Who's your competition might be based on the piece of product or service you're discussing. So we have many small, undifferentiated, if we have many small, undifferentiated organizations, they're all providing a lot of different services. There's a ton of them. That's perfect competition. Perfect competition. I'm going to go out and get something to eat for dinner tonight, and there are restaurants everywhere, right? Nobody owns me as a restaurateur employee, as a person seeking food, right? Perfect competition. I have information. I can Google the menus and look at the pricing. If you have many but small differentiated organizations, meaning there's a lot of organizations, but there's only a couple skilled nursing facilities, maybe only one or two locally. There's only one big hospital. There's only two radiology centers. Then it becomes monopolistic competition because they own each of their little corners. Now, in consolidated markets, where maybe you're in an area where a huge health system owns the entire integration of care from outpatient centers all the way through skilled nursing, they own it all. That's where you can say something like, oh, it's a monopoly, or oh, it's an oligopoly because there's a few of them, if it's a consolidated market where they're providing all those services. If everybody's providing little different services, or if there's a lot of them, right, it's a more fragmented market. Now, one of the pieces of our text that I believe, the pieces of strategy that I believe our text doesn't go into a lot of detail is the 5 forces framework, okay? So the 5 forces framework, Porter developed this as a way to think about who we are and how we compete. We look at whether or not if people can enter our market. Can another coffee shop open up next to my coffee shop? Can another radiology center open up next to my radiology center? The threat of new entrants. We look at the bargaining power of buyers. Can community members ask for lower rates? Can they bargain down the price of my services? And then the bargaining power of suppliers. Can suppliers of staff and actual supplies, right? Can the person who sells me the hip implant charge me more based on their bargaining power? And then can people go somewhere else or receive a different product instead of what they're getting from me? So maybe alternative medicine or something else. There's a threat of substitute products. So this is the detailed version I put together. This is the version from your textbook that just says, okay, whether or not you're really competing and you have an industry rivalry has to do with whether or not there's substitutes for the service you're providing, whether or not new people can enter your market, whether or not you have strong bargaining power with your suppliers and your buyers. Now, when we evaluate our rival positioning, we have a couple things we want to consider. And part of that is strategic grouping. So a strategic group is any group that identifies organizations that have similar business models or strategic orientations that are in direct competition. And these groups can be distinguished based on factors such as price, quality, geographic coverage, product being offered, distribution. So when we think about if you're operating a hospital and there's another hospital down the street, they're part of your strategic group. But if you're operating a hospital and there's a skilled nursing facility down the street, they're not your competitor. They are a next level of care. And so we have to be able to understand who's really in our strategic group and realizing that sometimes we compete with different people over different products, right? Walmart may be selling desks and their key competitor might be Wayfair, but when Walmart sells food, their key competitor is the public supermarket, right? Like it depends on the product then. So we have to think about that too. Now, as far as how we look at competitive advantage, part of that involves reflecting internally at our internal resources and saying, are we good? What do we need to change? Who are we? And do we have our resources leveraged appropriately to accomplish our goals? And if we have resources that are valuable, rare, difficult to imitate, don't have substitutes, that means we're more competitive, right? Now, we do a lot of different types of analyses. One of them is a SWOT, where we look at strengths of our organization, what we're good at, weaknesses, what we need to improve on, opportunities, things we see in the external environment that we could take advantage of, and threats, maybe something in our external environment like another health system coming in. We do that analysis. There's also another type of analysis we do called value chain analysis. And this is a view of a value chain analysis. This is the full delivery of a service, from pre-service when it's scheduled to when it occurs, point of service, to the follow-up afterwards. Maybe this is a surgery, so we've got a visit or two, a surgery, some follow-up. Underneath this, This explains that when we think about a service being offered in healthcare, we have to consider the infrastructure, culture, resources, and technology all required to support that service. So if the top service delivery, if this is, I built one of these once for a cancer center, if this is provision of patients of care to patient, if this is provision of care to patients with breast cancer, then we need to make sure we have the right infrastructure in place, right? The right resources too. But when I say infrastructure, we have data, we know what we're doing and why, we have a plan. We have culture. We all agree, we work together to, for the most part, we have shared values and assumptions and understanding. We have the right people, IT, financial resources, and all the development and applications from a technology perspective to support that. And that's the value chain. Now, this is another view of a SWOT analysis. This one is saying that we have internal and external opportunities, internal strengths, internal weaknesses, and major threats. And so when you do a SWOT analysis, you may be thinking, what opportunity can I take advantage of? Opportunity. What is coming at me that I need to deal with? Is there not just someone entering the market, but am I losing patience to someone who's been in the market? So this is a really cool tool that we've been using the last 25 years really heavily in healthcare to understand our organizational position and whether or not we have any competitive advantage. Now, there are a lot of different strategies that come out of the SWOT. When you do a SWOT and when you think about who you really are, it helps you think through whether or not you are the least expensive. We call that low-cost leadership in your service area. Whether or not you're differentiated, you're special, you're fancy. Whether or not you're focused, whether or not you have a time advantage where you've already implemented something new, maybe you're the first organization that implemented a certain robotic surgery. So the analogy that I use to kind of break this down is when we think about these generic strategies, who we are and where we fit. If you were selling wedding dresses, would you be the Walmart of wedding dresses, the Macy's of wedding dresses, the boutique couture wedding dress store, right? The David's Bridal. So in healthcare, we have organizations where it's like, yeah, I'm the Walmart clinic. Yeah, kind of doing my normal thing. Oh, I'm the plastic surgery Macy's clinic. Like, people know what their market is. And this is a viewpoint of that, looking at whether or not you have strategic advantage. Are you low cost or are you unique, low cost or special? And then are you targeting a market that's very focused or very broad, right? Is it all hospital care or is it just a certain type of cancer care? And so this helps us think about those strategies. This next slide kind of brings that back around again. This looks at, as we go through the life stage of a product or service and it's growing, maybe even a new organization, we can think about it that way. What is the concentration level versus the competition level? So if I'm an emerging organization, right, or an emerging product, you get a lot of that volume, a high concentration of patients and individuals interested, hopefully. Competition will be low because it's new. So if I create the first ever cell phone that teleports you places, right? Or the first ever AI-enabled physician visit technology. That is an emerging technology. I will have a high concentration of the market share because it's just me, but low competition. As I grow, that concentration decreases, competition increases. And then you get to a place where there's extremely high competition at the end of your life cycle as things are declining. Now, we do something else in healthcare called portfolio analysis, where we not only think about whether or not we are the boutique couture store of healthcare, or whether or not the services we offered are aimed towards a certain population or a certain income range. We're also thinking about our own financial viability, our own strategic direction for decisions. And so let me show you this. This is a review, an overview graphic looking at how competitive you are and your environmental attractiveness. So, are you super competitive? Are you the best? And does your environment support that perception that you're the best? So, looking at the second side of the graphic with the 4 squares, we have these different categories. We have the cash cow, the star, the dog, and the cash cow again. Now, if something has high growth, it's growing very fast, but you don't have a lot of market share. So it's small right now, but it's growing. We call that a cash cow. If it's not growing very much, but it's still a high market share, you've already got a lot, but the growth is pretty stable. It's not growing more, but you have a lot of patients. That's still a cash cow. Stars are the ones that you have a ton of patients and the clinic is booming and it's growing 20 more every day. That's a star. A dog is ones where you don't have a lot of market share, you don't have a lot of profitability, you don't have a lot of growth, but maybe it's something you need to do for the community. Maybe it's something that's still essential. And so this is one viewpoint. Now, if you Google competitive positioning, there will be other names that are used, right? There's like shooting stars, like people have created subcategories. It gets really interesting. But this should give you kind of a high-level overview of how we think about classifying services and thinking about strategic advantage. All right. Well, I hope this was helpful to have just a short overview on the chapter. Please reach out to me with any questions. Always communicate with your instructors. We are here to help.